Today, our special guest is Miss Jennifer Reeder, who is the Alzheimer's Foundation of America's Senior Director of Educational and Social Services. She's responsible for overseeing the educational programming for dementia care professionals and care partners, the AFA helpline and in-person therapeutic and community classes, and the Alzheimer's Foundation of America Teal Room. Ms. Jennifer is a licensed clinical social worker, and her job and her dedication is to see that those persons who are diagnosed and affected by Alzheimer's and related dementias receive the support and educational resources they need when faced with the extreme challenges of dealing with this disorder. In her spare times, Jennifer is said to enjoy any activity that involves spending time with her dog. I like my dogs too. In any event, at this point in time, I'd like you to give your full attention to Ms. Jennifer Reeder from the Alzheimer's Foundation of America, who is going to talk about the services that are provided by the Alzheimer's Foundation of America for care partners and professionals who care for persons living with Alzheimer's and related dementia. Ms. Jennifer.
Hello, everyone, and thank you so much, Dr. Parker. Greatly appreciate everything that everyone is doing, and so happy to be providing this presentation to you all. So I'm going to share my screen so you can all see my PowerPoint. I really enjoyed that workout too. Gotta say, I feel pumped. I feel ready. Okay, so as shared, my name is Jennifer Reeder. I'm a licensed clinical social worker and the Senior Director of Education Social Services with AFA. I've been with AFA for close to 6 years, a little over 5.5 years. So our mission to start with at AFA is to provide support, services, and education to individuals, families, and caregivers affected by Alzheimer's disease and related dementias nationwide, and fund research for better treatment and a cure. So my presentation today is going to be getting into how we're working towards meeting our mission. So just wanted to first share a little bit about how AFA was founded. So AFA was founded over 20 years ago in 2002 by Bert Brodsky. So Bert Brodsky was a caregiver for his mother, and he really felt like there weren't enough services and resources and mainly supports for families at that point, as well as education, because I think that we always think about how education is so important for professionals, but especially for family members, for the individual who's been diagnosed with Alzheimer's disease, and so that families know about what the progression of the disease looks like. Because I think many people, when they think of Alzheimer's disease, they think of memory loss. But there's so many other types of symptoms that people can experience: agitation, aggression, confusion, disorientation. So it can be really helpful for families. And so that's what Bert Brodsky was trying to do, was trying to ensure that no other family would have to go through this journey alone, and that they could receive these types of services and resources and education, unlike that they were able to receive at that time. So the programs and services, so this is what I'm going to be going over today. So our helpline, our memory screening, support groups, activities, our trainings, as well as our publications too. So I'll first start off with AFA, so our helpline. So our helpline is the heart of AFA. I feel like everything that we do is in part for our helpline, because our helpline is basically a lifeline for so many people. Many people who call in to our helpline, they've been trying to call other organizations. They've been trying to find that support. And so that's what our licensed social workers do. All of the social workers that are on our helpline are licensed and have been thoroughly trained in dementia care. So we're here to provide resources and services that are in your area. And we're also here to provide guidance, and sometimes just to listen. I think so many people who call in are really frustrated at that point because they feel that they haven't been listened to, they haven't been heard. And so that's really, really what we're trying to do. Many times people call in for one type of resource and then realize there's all of this other information that we can offer them. So people can call in by using the phone numbers you can see here, 866-232-8484, using our web chat or text message as well. So, as I just mentioned, we're here to provide answers to questions about dementia, caregiving, brain health, support to caregivers in their time of need, and then that information about local resources. So what's really, I think, amazing too is that our web chat, we can communicate with people in over 90 different languages. So, trying to ensure that language is not a barrier for anyone. And we also offer caregiver support groups as well, and support groups for individuals too who have been diagnosed. And most of the time we provide our support groups through our helpline. So meaning that all of the people who facilitate our support groups are licensed social workers who work on our helpline. So we can offer support groups either in person, over the phone, or through Zoom as well. And also, we've provided, we did a support group not long ago for people who had just been recently diagnosed with Alzheimer's disease, which can be incredibly, I think, a challenging time for people. So to receive that peer support, I think can be really helpful. And something that I think is so interesting, when it comes to the journey for individuals who support a family member, or someone that they care about in their community is through this journey, you learn so much about yourself. You learn so much about approaches, techniques, resources, services. And so, individuals are able to share what it is that they're learning through their journey with those who are part of their support group. So, people can find it very, very valuable. And it's a really challenging time, right? I mean, we're experiencing ambiguous loss, anticipatory grief, and what does all of that mean? And then we also have our virtual helpline assistant as well. So when our helpline is closed, so we're open 7 days a week, 12 hours a day, 9 a.m. to 9 p.m. Eastern time. So when we're not open, we have our virtual helpline assistant. So this is where people can ask all different types of questions, receive answers in the moment. And then if the individual needs additional answers, they need additional information, they can open a helpline ticket. So when they open that helpline ticket, once our helpline is open again, then people can receive a call from our social workers. And, some people prefer not to talk on the phone, maybe because they are caregiving and it can be challenging, to be on the phone. So people can also communicate with us through email as well. And we're hoping that at some point we can start offering memory screenings through our helpline as well. So in regards to our National Memory Screening Program, so memory screenings, just to be very clear, is not a diagnostic test. It's not to diagnose anything. It's really just to be able to identify whether there may be any concerns with a person's memory and whether they should talk with their doctor about that. We partner with organizations throughout the United States where either care settings may want to provide memory screenings or community settings may want to have memory screening events where people in their community can come to the event and receive a memory screening. And so it really helps to reduce any barriers to healthcare at times. Many people may not think to talk with their doctor about what it is that they're experiencing. So receiving a memory screening can also provide that education about brain health and what to talk talk with your doctor about. So as you can see, more than 5.1 million people have been screened to date. And so anyone can reach out at any time to schedule a memory screening by calling our main number, 866-232-8484. You can either get a memory screening in person if you're here in New York City, or there's a community or care setting close to you that is providing those memory screenings. Or, we can provide those screenings through Zoom as well. We have our community programming. So our community programming, we offer therapeutic programs in person. We also have a video library of our virtual activity programming too. So the in-person ones we offer in New York City in our Teal Room that is a part of our office here in New York City. And then we also just recently opened up AFA Barbara Rabinowitz Education and Resource Center on Long Island. It is a beautiful space where they offer multiple therapeutic programs most days. And I'll just say too, the vendors, the people who come and do the programs are absolutely amazing. I mean, we have creative arts therapists, we have music therapists, we have all different types of programs. We have Reiki coming in at times. So we really try to be very broad and diverse in the programs that we offer for individuals, because as we know, not every single person likes art. Not every single person may be into Reiki. So that's why we really want to make it very diverse to try and meet the needs and the interests of everyone in our communities. We have our educational programming too. So that is through our AFA Educating America tour, where we offer conferences almost every month throughout the United States. So I was just looking at the schedule just this morning. So in October, we were in Charleston, West Virginia, and then we're going to be going to Boca Raton very soon as well. But we've been to Jackson, Mississippi, Albuquerque, New Mexico, New Orleans, Chicago, Portland, Cleveland, Omaha. So as I said, just about every month we are going to a different state offering these conferences with amazing speakers on brain health and other topics related to dementia-related illnesses. And then and those are all in person. So our Care Connections webinar, this is a free webinar that is geared towards individuals, towards caregivers, but we also have a lot of professionals attend as well. Because as professionals, we need to keep on learning. Keep on educating ourselves. So our Care Connections webinar is offered the second Thursday of every month from 1 o'clock until 2 o'clock Eastern time. And yet again, we are offering all different types of speakers, all different types of topics, from depression to dental health, just about anything and everything. And our Care Connections webinars, those are every single month. And then we have our AFA Fireside Chat too. So our AFA Fireside Chat, this is an opportunity for, most of the time is going to be our CEO, Chuck Fuschillo, who is the host, who just has a very casual conversation with a professional, with an expert in the field, having a conversation about different types of topics that are very, very close and important to caregivers and individuals affected by dementia-related illnesses. So you can learn more by going to our website. We also have our professional trainings too. So although a lot of the supports that we offer are geared towards individuals, toward caregivers, we know that there is that parallel process, right? We have to teach professionals how to be supportive to caregivers, to teach caregivers how to be supportive to the person that they are caring for. So our professional trainings, we offer those as in-person events. We also offer them as live interactive webinars. We offer our trainings, our live interactive webinars on the third Wednesday of every month. And then we also offer our live interactive webinars to specific communities as well, and to specific states that receive grants. So for instance, we are providing our live interactive webinars to the state of New Mexico and the state of Mississippi right now, both of which organizations within those states had received grants through ACL to provide education. So, and then we also have our Alzheimer's and Dementia Online Academy too, where people can take our on-demand courses at any time. And all of our courses were able to provide continuing education credits to licensed social workers, case managers, and other professions as well that accept CE credits, social work CE credits. I was trying to think about what we have coming. So we did just provide family dynamics in dementia care, and I believe next month is going to be a training about PTSD and dementia. So in that course, we talk about the bidirectional relationship between PTSD and dementia. So how PTSD, chronic stress, can affect brain health, leading to increased risk of dementia-related illnesses, especially Alzheimer's disease. And then what the experience is like for individuals who have experienced trauma in their lives, have Alzheimer's disease, and those coping mechanisms are starting to deteriorate. So how people can have a reemergence of traumatic memories. But we also have trainings too that are all about, about cultural competence in dementia care, about how connecting racial disparities to increase cases of Alzheimer's disease among Black Americans. So, we really try to hit those areas, those topics that we believe are just not talked about enough in the education world of Alzheimer's disease. And through all our education, we provide our certification programs as well. So we have Excellence in Care. That's the AFA's national accreditation for dementia care settings. So after we do a very rigorous in-person evaluation of the care setting, talk with all of their staff, with their leadership, they can receive an EIC Distinction Award. We have our Professional Foundations program. So this is a certification training program for organizations to become certified in comprehensive care for those living with dementia-related illnesses. So the care settings, really any type of organization that wants to show that they have been educated about Alzheimer's disease and dementia-related illnesses. I mean, it could be even a law firm. Professional Foundations is a good fit for those organizations. We also have our Certified Comprehensive Dementia Care Provider. This is a 2-year certification program for professionals to show that they have gone through, I believe it's at least 5 courses of our courses. So this would be general courses, social and cultural competence courses, as well as clinical courses. And then everyone needs to complete a practicum seminar where they can practice their skills, and then they receive their 2-year certification. And then we have our AFA Certified Dementia Care Partner certification as well. So this is where individuals who take AFA signature training, that's Partners in Care supporting individuals living with dementia. After they take that 6-hour course, then and also pass an exam, they can receive their DCP. We also engage in federal advocacy as well. So AFA's Washington, D.C.-based public policy department works with federal policy makers and advocates on behalf of families affected by Alzheimer's disease and other dementia-related illnesses. Some of the policies and bills that we have supported are Credit for Caring Act, alleviating barriers for caregivers, the Alzheimer's Law Enforcement Education Act, the Change Act, as well as the Centers for Medicare and Medicaid Services. So, we try to reach, and try to educate and try to advocate on all levels. When we're thinking about social work, it'd be like the micro, meso, and macro levels. And then we have our publications too. So we have Alzheimer's Today, which is AFA's free magazine for caregivers of individuals living with Alzheimer's disease and related illnesses. Each issue provides helpful information from professionals and caregivers, personal stories from people affected by Alzheimer's, and tips on health and wellness. Really, really highly encourage you all to sign up for the Alzheimer's Today magazine. Everybody loves it and finds it as a huge educational resource. And then we also have these books too, our children's books. So Dancing with Granddad and Gardening with Grandma. These books are geared towards teaching adults how to talk with children about Alzheimer's disease in a way that may not be too overwhelming, but is very educational. I think so many people think that we really shouldn't talk with the children or bring the children involved into all of this until we really have to. Well, we know that children are very, very intuitive and pick up on just about any bit of change. So, we believe that it's best to educate children as soon as possible and to include the individual who's been diagnosed in that conversation to provide that reassurance to the child, and then also talk about the things that you can do to help and the things you can do to continue to connect with the person that you care about. Giving back. So AFA gives approximately $1 million each year in grant funding to support initiatives such as Alzheimer's research projects, activity and therapeutic programming, respite care services, and that goes towards organizations, not individuals. Wandering prevention programs. So we partner a lot with Project Lifesaver. That's a wandering prevention program. And then also college scholarships for high school seniors impacted by dementia. So this is where where high school students will submit their either written testimony, their written summary about their experience of being impacted by dementia-related illnesses, or they sometimes also send in a video as well. And so incredibly heartfelt. I'm just so in awe of these young people. And then investing in hope. So AFA has funded research conducted by leading institutions, including Emory University. Shout out to Emory University right now, as well as all of these other organizations too. And just want to point out that 100% of all donations designated for research are used to fund scientific projects. 100%. So, reach out to us. We just highly encourage you to reach out to us. And as I said, AFA's helpline is the heart of AFA, staffed by amazing licensed social workers. So I just highly encourage anyone and everyone to reach out when you need that support and when you need those services and resources.
Oh, on that note, thank you so much, Jennifer, for coming before us and presenting this information. You made a lot of reference to special classes and certifications for caregivers who are caring for somebody, family caregivers, but also for healthcare professionals, excuse me. The certification courses, are those offered online? Is that what you were saying? Because I have some questions from family members. Should we take this educational class?
Sure. So the certification program is geared towards, I'd say, professionals that want a certification, but we always encourage individuals, for family members, community members, to take our courses. We're very intentional in the way that we develop our courses, that they may be geared towards professionals, but individuals and family members, community members will get just as much out of those courses. So we try to maintain a language that anyone can understand. But so the certified comprehensive dementia care provider. So that would say that's on like the next level after certified dementia care partner. So certified dementia care partner, that's when you are taking the partners in care training, 6 hours long. And it's really, really helpful for people who are providing direct care. And I've had many family members, family caregivers provide to take partners in care supporting individuals living with dementia. And we do offer that on our learning management system. So anyone can take that at any time. And then the certified comprehensive dementia care provider. So the next level up, this is where people may also be taking our cultural competence courses, our clinical courses that may be at a higher level from beginner.
Is there a cost for either of these programs?
Yeah, so the certified comprehensive dementia care provider, there is a cost of that. That's $150, and it includes 5 courses plus the practicum seminar. So, and all 5 courses provide continuing education credits. So you're basically getting like a bundle deal when signing up for the certification program.
Okay, so the gentleman who asked the question is apparently somebody who's also received a diagnosis. And I think he wants to make sure that he's doing better, but your response is that everybody should feel free and comfortable to take the first level course, which is Certified Dementia Care Partner. He and his family can probably take that course together. And somebody may want to get additional training, more certification. But I think from the standpoint of awareness of the disease, we don't necessarily have certification. You have other programs for that, right?
Yeah, that's like with the monthly webinars that we offer, the live interactive webinars. I always recommend that people take those, because we offer a different course every month. And as I said, like it can give people some insight. It can give caregivers some ideas on how to be able to best support the person that they are caring for.
So that monthly webinar, is that accessible on the phone line, or is there a separate website that I can put in the chat?
Sure. So that is on our website under professional trainings. You'll see that there's one, I think, about monthly webinars. But I do want to say that if anyone is attending in a non-professional reasons, like for either being a caregiver yourself or being an individual who's been diagnosed, I'm always happy to send the link that bypasses the payment step so that family caregivers and individuals can attend for free. So I'm happy to do that.
So they should contact you directly. If you could put up your direct contact slide.
Yeah.
Okay. Again, there are certification courses for professionals and others, and somebody has already put that up there. And the link we have is alzheimersfoundation.org/caregiving resources webinars. That's the monthly one, Jennifer?
Yes, that would be for Care Connections. Yes.
Okay. And that's free or not?
That is free.
Okay. And then for the certification courses, they do come with a fee, but if you contact Ms. Reeder directly, she can probably help you. And she put her email in the chat, jreeder@alzfdn.org, jreeder@alzfdn.org. But monthly webinars for those of us who are family caregivers and want that kind of access for our families, for ourselves and our families. You mentioned, this is the Care Connection series. There we go.
Yeah. So what we have coming up, just so you know, for Care Connections, because I think the one that I did last month is still up about how to support and advocate for LGBTQ older adults. What we have next month is it's going to be a really, really good one. Justin Russo, who is with the Institution for Music and Neurologic Function, he's going to be sharing just the power of music for people who have Alzheimer's disease. So I highly recommend that people attend that one.
We're getting ready to start a music as medicine program here. So
Oh,
I'm
amazing.
kind of keyed into listening to that and looking at it.
Yeah.
Yeah.
He's great.
That's going to be really, really helpful. We might need to get him to come on Brain Talk Live and talk about it.
Yeah.
Anticipation of this workshop.
Yeah, I have a course that I developed. It's called Tapping into the Power of Emotional Memories. And he actually partnered with me on the last time that I did that. So he did a section about music and memories, and it was really, really good. So it's gonna be great.
Okay. So one question, you are based in New York. The Alzheimer's Foundation of America is based in New York, and you have a teal room and 2 sites that offer on-site training. Is there a plan to expand that training that you offer there in New York to other states?
Yeah. So, do like, are we going to open another site or?
Yes. Yes, you have the Teal Room which is in Manhattan, and then you're out in Amityville where you have the Alzheimer's Resource Center.
Right.
I know that you're around the world giving talks on Alzheimer's awareness, and you talked about your traveling show, and we actually participated here in Atlanta in one of those programs. We actually had it here on site on our campus, but is there a plan to do that elsewhere? Because the kinds of therapeutics that you're offering, the Teal Room kinds of plan, is that being offered any place outside of Manhattan and Amityville, New York? We do have people who are listening who are from New York, but
yeah. So the Teal Room and the Education Resource Center on Long Island. So both of those areas, that's where we provide our therapeutic programming, and we are always looking to expand, always. I mean, as you know, like our reach is nationwide, but physically we are in New York State. And I know that, our CEO, I think he's always looking at Florida, and other areas, to be able for us to continue expanding. There isn't any definite or that I know of quite yet, but it would I wouldn't be surprised if it might be Florida. Florida would be the next state that would be going to.
Okay, right. Let's see. I see Dr. Trammell and I and Emily were all trying to generate answer several different questions from different people.
Sure.
Let me see what Mrs. Burns, I'm going back to a couple of questions here. Number one, is the Alzheimer's Foundation of America bringing one of their programs to the Atlanta area soon?
Good question.
Do you have a schedule for where these programs are going to be?
Right. So yeah, you know what? I'll have to look and see what the calendar, what the events, when the Educating America Tour conference is going to be coming, where it's going to be going next year, and whether it's going to be going to Georgia. And I can let you know about that, Dr. Parker, and send that information to you.
Okay, we'll certainly send it. But one of the things, again, we have in the chat a way to get in touch with or get informed about the different courses that are being offered every month by the Alzheimer's Foundation of America. And again, a live link is in the chat. The other question that we have here, as I'm going through here, this person wants to know something about how to calm down a patient who seems to be getting highly agitated and physical. Do you have a ready reference for that? That's addressed by Ms. Burns, Pamela Burns. Or is there a special site you want us to go to learn more about that?
Sure. So we do actually have a training coming up, I think next month. It's called Understanding Behaviors as Forms of Communication. So that would be a good one for, and if that person wants to reach out to me, I can send more information. Cause that one might be for the state of Mississippi, which would be free then. But we always try to reframe, behavioral symptoms as responsive behaviors, because what we want to do is we want to try and figure out what is the person responding to. They are responding to something, even if it is a psychosis, even if it's something that's going on in their own world, because we have to remember that we always have to enter that person's world who has Alzheimer's disease. We can't expect the person to come back and enter our reality. And so if we can figure out what it is that they're responding to, that can be really, really helpful. So are they responding to a traumatic memory? Are they responding to the environment in which they are? As the disease progresses, it becomes more and more difficult for the person to be able to communicate their needs, and communicate what it is that they're experiencing. So that's where we need to, and they're basically communicating through those behaviors of agitation and aggression. So if we can learn about what it is that they're responding to, is the person too hot? Are their clothes uncomfortable? Is it the lighting? And sometimes, it can be our own approach as well. We may not realize that our tone of voice, is a certain way, and they're picking up on that. So there could be all different types of things that the person could be responding to. But the best thing that you can do in those moments is to ensure your own safety, ensure the safety of the individual. If you need to take a couple of minutes to get into a place of wusa, a place of calm and patience, then give yourself that time. Because we have to be like the leaders in a way of that interaction. So if we can stay calm, then we're going to be able to help the person get to a more calm place and be able to lower their distress. But
I see where Miss Burns has added another question. Can two people take the course together if they're in the same household with the same patient? A family orientation. And I think if you haven't really been hearing Miss Burns or anybody else who's concerned about caregiving as a family about a specific individual, again, there in the chat, there is a link to caregiving resources webinars given by the Alzheimer's Foundation of America that you can take as a family unit. There are special certification courses that are a little longer lasting for people who are in families and who are caregiving professionals, whether you're a CNA or just a paid caregiver who's not necessarily a PA or a licensed social worker or anything else. So there are courses that different levels of care, I should say that, different levels of professionalism. But within the monthly resources, there are a number of courses that family members can participate in together. And that's actually a very good idea, to join these different learning seminars together with other family members so that all of you kind of get the same understanding and you come in on the same wavelength for caring for your relative. And that's very important.
Yeah. And I think if you're caring for someone and there's also a professional caregiver in place, I think it's always good to take those trainings together as well. So you're on the same page, you're on the same page with how you're responding to agitation, aggression, instead of responding in all different ways. Cause I think consistency, structure, is really, really helpful for the person.
Okay, I'm going to say this to Miss Burns. I'm going to say thank you again, Miss Jennifer from the Alzheimer's Foundation of America. Ms. Burns, and to other families, there are special accommodations that can be made for the paid courses, but there are courses that you do not have to pay for. Mm-hmm. And we put the webinars in the chat, the Alzheimer's Foundation Caregiving Resources webinars that are offered every month that you don't have to pay for. For the stepwise courses and certifications, there is a payment, but if families, that cost can be waived. Ms. Reeder is amenable to waiving that cost for you. So she has her email there in the chat, JREEDER at alzheimersfoundation.org, ALZFDN.org, JREEDER at ALZFDN.org. And so thank you so much, Jennifer. You're free to go at this point in time. Thank you all for joining us.